Hello everyone, and welcome to the second webinar of this series, Making It Happen. My name is Frederica and I am part of the EDGE team. So over the years I've traveled to a couple of emerging markets, some of them being India, Brazil and Mexico, and some issues really caught my attention and highlighted the importance of impact business in my eyes. So throughout this series, we will try to give you some perspective and background of serious challenges that low-income people face, and how some businesses are tackling them and making an active contribution to improving the quality of their lives. So throughout the webinar, please feel free to use the chat room function, pop in any comments or thoughts you may have, and we will definitely cover them and discuss them further. So let's get started. So let's look at this diagram. I just wanted to do a quick pop quiz. Does anyone know what this graphic represents? All right, now does any of you know which symbol refers to which Millennium Development Goal? Let's try to have a quick guess here in the chat room. Go. Did you get the meaning of the symbols right? Let's talk a bit about how they were created in the first place. So in September of the year 2000, leaders of 189 countries met at the United Nations in New York and endorsed the Millennium Declaration, a commitment to work together to build a safer and more prosperous and equitable world. The declaration was translated into a roadmap setting out 8 time-bound and measurable goals to be reached by 2015, known as the Millennium Development Goals, as you can see in the slide. So they are basically referring to eradicating extreme poverty and hunger, achieving universal primary education, promoting gender equality and empowering women, reducing child mortality, improving maternal health care, combating HIV, AIDS, malaria, and other diseases, ensuring environmental sustainability, and developing a global partnership for development. So let's look at the Millennium Development Goal number 5. Does anyone know what type of work is being done under that goal? Let's have a quick guess. Okay, let's find out. So this is the work that's being done. So reducing maternal mortality by 3/4 and achieving universal access to reproductive health. So maternal health refers to health of women during pregnancy, childbirth, and after birth. While motherhood is often a positive and fulfilling experience, far too many women are associated with suffering, ill health, and even death. The major direct causes of maternal morbidity and mortality include hemorrhage, infection, high blood pressure, unsafe abortion, and obstructed labor. So did you know that every day approximately 800 women die from preventable causes related to pregnancy and childbirth? The high number of maternal deaths in some areas of the world reflects inequities in access to health services and highlights the gap between the rich and the poor. As you can see in the slide, 99% of maternal deaths occur in developing countries. That's so sad. So why is maternal health care so complicated for some women? Why is this? Okay, so let's talk about money. So let's take the people who live in slums in Nairobi, for example. They get paid less than $100 and a standard delivery costs around $300. So money is an issue to pay for such services, right? And then as if that's not enough, let's consider the distance factor. That's not a struggle because even if there is access to maternity services, they only exist, let's say, in 4 hospitals in Nairobi, and they are not close to the slums, which is where the women who need them are. And also, knowing what to do when you're pregnant is not simple. If women in the slums don't have access to proper education, how would they know what to do and what to avoid to protect themselves? Or even what is an inadequate service, or what should they be looking out for? And adding to that the cultural practices, all these problems just add up. All the reasons we just talked just now contribute to complications such as severe bleeding, especially after childbirth, like infections, which usually happen after childbirth because the mother is exposed to unhygienic conditions in the recovery period when she's more sensible. Also, high blood pressure during pregnancy, unsafe abortions. Remind ourselves of the target to reduce maternal mortality by 3/4. The latest MDG report said that most maternal deaths are preventable, but progress in this area is falling short. So globally, the maternal mortality ratio has declined by 47% over the last 2 decades. So this means that from 400 maternal deaths per 100,000 live births, it has decreased to 210. So that is from 400 to 210 per 100,000 live births. And this was between the period of 1990 to 2010. So meeting the MDG target of reducing the ratio by 3/4 will require accelerated interventions and stronger political backing for women and children. So that's what the MDG report advises. Let us introduce you to impact business. The businesses in this field are financially sustainable ventures providing basic products and services to low-income populations. Some of those basic services can be about improving maternal health care, right? So based on what you heard so far, can you think of what type of initiatives would help pregnant women? Let's share a bit here in the chat room. Okay, great. So now let's look at some of the characteristics these businesses should have to become successful models. So what characteristics are core to these businesses, do you think? Let us, from our experience, tell you a bit about 3 top key characteristics that we found are very common in the successful businesses that we've worked with. So let's start with the first one. So the first one is they are permanent and self-sustainable. So these businesses don't depend on grants, donations, etc. They depend on the success of their core product or service. So in essence, they make profit through their business core, which ensures their own sustainability. So for example, if their business is to sell toilets, for example, then their profit needs to come from selling that product. So the second characteristic is to do with accessibility. The products and services need to be easy to access to its customers. So first, one must look at the profile of the customers at the base of the pyramid. Making a product or service accessible means whether they are available in the local language of the customers. They can reach the product easily or not. Do they have to pay for multiple transportation, or is it nearby where they can see it? And the last one is to do with scalability. So the businesses created in this field are addressing problems of millions of people. It's just not of one person, it's millions of people. Therefore, the business needs to think about scale and not only about a small community. Does the business have the possibility to grow, expand, and reach millions? And as a consequence, the financial sustainability is very dependent on this point. In some businesses, the financial model only sees return if it reaches a certain scale. And is also an important point for investors if you're interested in that. Just to give you a bit of perspective, almost all maternal deaths 99% occur in developing countries. More than half of these deaths occur in sub-Saharan Africa, and almost 1/3 occur in South Asia. So in the next minutes, we will be taking you through a couple of business solutions that are tackling such scary numbers. And now that you understand the challenges behind maternal health care and have an idea of what impact business is, let's start by learning about this business in India that is combining both. Let's listen to this documentary about LifeSpring.
I was in India recently to do a story on how many young mothers and babies are dying just in childbirth, and an American organization that is doing all it can to make a change.
In this poor neighborhood on the outskirts of Hyderabad, India, Dr. Rama Devi is on a mission.
Hello.
She is talking to young mothers about the health of their babies and their own health during pregnancy.
So you gave birth here?
Entire families live in these one-room homes, often including the in-laws.
So all of birth?
It was a difficult labor and baby died after delivery.
Nearly 2 million babies die here in India every year, most in their first month of life, and most to mothers who are too poor to pay for medical care. The public hospitals are overcrowded and often charge bribes for care that is marginal at best. From mother to mother, the stories are similar.
Neither one of the twins survived?
A child lost while delivering at home. Dr. Rama tells them they now have a better choice. They can come to a new maternity hospital built just for them.
That could provide quality services at a price that women making anywhere from $2 to $5 a day could afford.
Jacqueline Novogratz and the Acumen Fund is investing in what they believe is the answer. They are building new, low-cost maternity hospitals called LifeSpring. 9 of them are now bringing top medical care to low-income families. A woman who comes to LifeSpring will get prenatal care here and regular post-birth counseling, and she can deliver her child for just $80. $80.
How many children do you have?
It would seem to be an easy sell for Dr. Rama's outreach work in the poor neighborhoods, but in this culture it isn't the mothers that need convincing, it's the mothers-in-law. It is they who will decide where a woman delivers her baby and how much, if any, money will be spent.
So the mother-in-law decides everything.
They actually look at her decision only.
These are women who've already delivered their babies?
Yeah.
In fact, just go to the delivery wards. There are the mothers with their newborns, and there next to them are their mothers-in-law.
How many visits does it take to convince them to come to LifeSpring?
Maybe 2 visits.
2 visits at least?
Yeah. They need to see the other women who had a delivery at LifeSpring. What is their experience at LifeSpring?
I can't help but notice all the pink. Why pink?
Every effort is made to make the hospital cheery. The walls and the curtains are fuchsia. Each new mother gets her own private space for her, her baby, and her mother-in-law.
What an interesting documentary, right? So LifeSpring was created in 2005 by Anand Kumar in India. They are hospitals that provide access to high-quality healthcare services for women with low income and also children. Complete support for women in pre- and postnatal care and during the birth of the baby are some of their services. Others also include prenatal care, deliveries, postnatal care, and community outreach. In terms of finances, they utilize what we call a cross-subsidy model of tiered pricing. And this enables LifeSpring to charge low prices in the general ward, which makes up to 70% of each hospital. This means different pricing is charged to different groups of people. So they opened, like I said, in 2005 in the outskirts of Hyderabad in Mulali. It broke even and became profitable in less than 2 years within the operation. They are present in 9 locations right now and have a plan to raise enough money to open 150 hospitals in India. It's crazy. Business we wanted to show you is called Jacaranda Health, and it comes from Kenya. They are creating a sustainable and scalable maternal healthcare delivery organization for low-income women. The maternity care services are at a fifth of the cost of other private hospitals and are located in the outskirts of Nairobi, where the women that need their services the most live. So this is what we talked about before, about the distance. Where are these businesses? They have to be accessible, right? So the interesting point of Jacaranda, on top of providing all the necessary maternity services, such as obstetric care, safe delivery, family planning, postnatal care, is that they are trying out more. They are exploring mobile and technological options to reach and support their clients. They are always in the lookout to become better in servicing their patients. They're really incredible. If we look at their impact, they have treated over 4,000 women at the maternity hospital and hundreds in their mobile van sites. Go to their website and check out more information. They have loads of information for those who are interested and way more detail. So please feel free to explore more. Reach the end of our webinar. We would like to leave you with some more links for further information and next steps. We would like to thank and recommend, above all, WHO, who has provided a lot of information and shared here today. We also recommend you to read one of IntelliCap's publication, here's the number and the name in the slide, to understand the views on healthcare. The latest MDG report also has wonderful statistical information to dig into if you really like that, and you're like me. Some other businesses around the issue of healthcare that you could potentially look up and get your hands into it is Saúde in Brazil, Narayana in India, Salud Fácil in Mexico, Clínicas del Azúcar in Colombia. There's loads of them. So healthcare is a really exciting industry to dig into in this area. So check them out, get a good understanding of how their models work. And see how you feel about working more with them and being more engaged with them. There's a whole list. Start there and just keep going. You'll find much more to do. One other thing we'd like to leave you with is an understanding of what type of jobs are there available in the area of maternal health care. What does it take to build and run such a business? So this is a snapshot of some of the jobs LifeSpring is recruiting for, and we're showing it to you so you can see the variety in job descriptions. We need everyone in this area, from management people that are capable of managing hospitals, for example, to nurses and doctors, to marketing and sales people that will get customers in and do the whole outreach program. And the most exciting thing is that they are not conventional jobs, because your customers are different. They have different needs and challenges. They have those of the BOP, which means base of the pyramid. And this makes your job challenging and makes you deal with something new every day. It's really something like thrilling working in this field. What is next for you? We are really excited here in Edge to have a speaker coming from Bid Network. And the next webinar, next Thursday, will be about, now that you've had all this background, help you frame your ideas into business models. Like, how can you then put things on paper and really get started? And Bid Network is going to be here with us, giving you inputs and advice, and also telling you how you can do it with them. Also, following up in the next couple of weeks, you'll be able to submit a business plan with them as well. So get tuned if you're into making things happen. And that's why we call our series with that name. Do join, tell your friends, it'll be really exciting. And because we want you to kind of get started after the webinar series are over, so end of October, we want you to join our photo contest, which is a first step for you to frame your ideas into business plans. So the first step we want you to take is to think of an idea that you have of a business that can improve the lives of low-income people in your community. So just submit a photo of you and your idea in a piece of paper that just explains and answers these two questions. So what is the identified problem in your community, and what is the business solution to solve this problem? So more details, like I told you, will coming up the end of October. But stay tuned with this because we really want to help you go through the process of creating your business. So this is the first step moving, like this is the brainstorming phase, ideation phase. Hope you join us on that one. So thank you so much for being with us today. We really hope it was useful. We managed to give you some new information and help you understand what you can do as well to get engaged with the field. Hope to see you next week, obviously. I hope you'll be there. Tell your friends. And also stay in touch with us by following our online channels. You can see on the slide we have our website and all the social media engagement as well for you. So we have on Facebook, YouTube, Twitter, and LinkedIn. So stay tuned and thanks so much for coming and see you next week. Bye.